Hi, my name is Dr. David Kulla. Today we're going to talk about frozen shoulders. What is frozen shoulder? Well, frozen shoulder is also called adhesive capsulitis, and it's a painful condition in which the movement of the shoulder becomes very limited. Frozen shoulder occurs when the strong connective tissue surrounding the shoulder joint, called the shoulder joint capsule, becomes thick, stiff, and inflamed. And the joint capsule contains the ligaments that attach the top of the upper arm bone, or the humeral head, to the shoulder socket, also called the glenoid, firmly holding the joint in place. This is more commonly known as the ball and socket joint. The condition is called frozen shoulder because the more pain that is felt, the less likely the shoulder will be used. Lack of use causes the shoulder capsule to thicken and become tight, making the shoulder even more difficult to move. It is frozen in its position, hence the name frozen shoulder. So who's at risk for developing frozen shoulder? Usually adults, most commonly between ages of 40 and 60 years old. On average, there's over 200,000 cases a year in the US alone, and it affects women more commonly than men. Another risk is if you've had a recent shoulder injury, any shoulder injury or surgery that results in the need to keep the shoulder from moving. For example, using a shoulder brace or a sling or a shoulder wrap, including a rotator cuff tear or any fractures of the shoulder blade, collarbone, or upper arm. If you are diabetic, between 10 and 20% of individuals with diabetes mellitus develop frozen shoulder. Some other health diseases and conditions include stroke, hypothyroidism, underactive thyroid gland, or hyperthyroidism, overactive thyroid gland, Parkinson's disease, and heart disease. Stroke is a risk factor for frozen shoulder because of movement of an arm and shoulder may be limited due to a stroke. Other diseases and conditions increase the risk of developing frozen shoulder, but they're not sure clearly how yet. So what are the signs and symptoms of frozen shoulder? First, frozen shoulders are divided into 3 stages. The freezing stage. In this stage, the shoulder becomes stiff and is painful to move. The pain slowly increases. It may worsen at night. Inability to move the shoulder increases. This stage lasts 6 weeks to 9 months and much shorter with cold laser therapy, more like 3 to 4 weeks. The frozen stage, in this stage pain may lessen, but the shoulder remains stiff. This makes it more difficult to complete daily tasks and activities. This stage lasts 2 to 6 months. If cold laser is applied, 1 to 2 months. Then you have the thawing or recovery stage. In this stage, pain lessens and ability to move the shoulder slowly improves. Full or near full recovery occurs as normal strength and motion return. The stage lasts 6 months to 2 years. When adding laser, it reduces time by 40 to 50% faster. So let's get into diagnosis and tests. How is frozen shoulder diagnosed? Well, to diagnose frozen shoulder, your chiropractor, primary care doctor, or physical therapist will do that by discussing your symptoms and reviewing your medical history with you. Conducting a physical exam of your arms and shoulders, the doctor will move your shoulder in all different directions to check the range of motion. And if there is pain with movement, this type of exam in which your doctor is moving your arm and not you is called determining your passive range of motion. The doctor will also watch you move your shoulder to see your active range of motion. The 2 types of motion are compared, and people with frozen shoulder have limited range of both active and passive motion. X-rays of the shoulder are also routinely obtained to make sure the cause of the symptoms is not due to another problem with the shoulder, such as arthritis or a misalignment of the joint. Advanced imaging tests such as magnetic resonance imaging, MRI, and ultrasound are usually not needed to diagnose frozen shoulder. They may be taken but to look for other problems such as a rotator cuff tear or shoulder labrum tear. What are the treatments for frozen shoulder? Well, treatment usually involves pain relief methods. Until the initial phase passes, if the problem persists, more therapy and in very rare cases, surgery may be needed to regain motion if it doesn't return on its own, especially if there is arthritis involved. Some simple treatments or non-invasive treatments include hot and cold compresses. These help reduce pain and swelling. The medical approach, medicines that reduce pain and swelling like non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen, Advil, Motrin, and acetaminophen, Tylenol. Other painkillers and anti-inflammatory drugs may be prescribed by your doctor. More severe pain and swelling may be managed by steroid injections. A corticosteroid such as cortisone is injected directly into the shoulder joint. The conservative non-invasive approach, which is 90% successful, is cold laser therapy or low-level laser therapy 3 to 4 times a week for about 4 weeks. Stretching and range of motion exercises taught by your physical therapist or chiropractor, and then a home exercise program. Continue those exercise programs at home for months after treatment. TENS unit is also helpful. It's a small battery-operated device that reduces pain by blocking nerve impulses. If these simple treatments have not relieved your pain and shoulder stiffness after about a year trial, other procedures may be tried. These include manipulation under anesthesia. During this procedure, you will be given a local anesthesia and your chiropractor or osteopathic doctor will manipulate the movement of the shoulder. This will cause the joint capsule to stretch or tear to loosen the tightness. This will lead to an increase in the range of motion. The other treatment is shoulder arthroscopy. Your doctor will cut through the tight parts of your joint capsule, capsular release, and small pencil-sized instruments are inserted through small cuts around your shoulder. These two procedures can and are often used together to get better results and in some severe cases used together. And lastly, frozen shoulder can be prevented. The chance of a frozen shoulder can be prevented or at least lessened if physical therapy, cold laser, or chiropractic shoulder manipulation is started shortly after any shoulder injury in which shoulder movement is painful or difficult. Your orthopedic, chiropractic, or physical therapist, doctors can develop an exercise program to meet your specific needs. I hope this video was helpful. If you have any questions or comments, don't hesitate to comment below. And we have another video we're coming out with next week that has exercises and stretches that you can do at home for frozen shoulder. Thanks for tuning in, and I hope you like this video. I hope you comment, and I hope you subscribe to the channel. We couldn't do it without you guys. Thank you.